Hi, Bess! How are you and the baby? I can't wait to see my goddaughter.
We're doing well, thank you, Bestie. However, I'm already in the second trimester, where I still have some spots every morning, and I experience nausea and vomiting, getting severe each day, and I don't know if it's still normal.
Maybe that is still normal since you are pregnant, but best is to see medical attention to confirm your health and the baby.
Maybe I will go to my OB/GYN next week for my checkup. Thank you for your advice.
You're welcome. Just let me know if you need some help. By the way, I gotta go. I still need to feed my babies. Bye! La, her tummy is bigger than the last time I saw her. Is that still normal? It is still not her due month, unless she is having twins to have that big tummy.
Morning, ma'am. I'm your reference, so I'm just going to ask you a few questions. So let's begin, ma'am. May I know your name?
Hello, nurse. Sure, my name is Isabella Magnayan, and I am 25, single, ready to mingle. My telephone number is 09887375. Contact me anytime and anywhere.
Wait, thank you for that information. So, ma'am, now, I'm just going to take your vital signs.
Sure, why not?
Uh, so, ma'am, all your vitals are within normal limits, but your blood pressure seems a little elevated, ma'am. So please wait until your number is called in OB/GYN department. So thank you.
Good morning, Doc. I will have my checkup for today. This is my 16th week pregnant already.
So good morning, Miss Kyla. How are you and the baby?
I believe that we are doing well, Doc. However, it is still normal when I experience vomiting, and it's getting worse every day. Also, I experience vaginal spotting.
Spotting? May I know if you still know the color of blood coming out?
Is this still normal? I'm already in second trimester, and I'm still experiencing severe nausea and vomiting.
Okay, Miss Kyla. We will going to run some tests and check your HCG levels. We will also have your ultrasound today.
Good morning, ma'am. I am Nurse Kimberly and I'm going to assess you with your lab test and assessment.
Please enlighten me, Doc. I don't know what is this I'm experiencing.
So what is H-mole? Gestational trophoblastic disease is an abnormal proliferation and then degradation of the trophoblastic villi. Molar pregnancy, also known as hydatidiform mole, occurs when what would normally become the placenta transforms into a growing mass of cysts. As the cells degrade, they become filled with fluid and appears as clear, fluid-filled, grape-sized vesicles. The embryo fails to develop beyond a primitive start. Abnormal trophoblast cells are associated with choriocarcinoma, which is a quick-growing form of cancer that occurs in a woman's uterus.
Complete mole. In a complete mole, all of the trophoblastic villi swell and become cystic. If an embryo forms, it dies early at only 2 mm in size with no fetal blood present in the villi. On chromosomal analysis, although the karyotype is a normal 46XX or 46XY, the chromosome component was contributed only by the father, or an empty ovum was fertilized and the chromosome material was duplicated.
Partial moles. In a partial mole, some of the villi form normally. The syncytotropoblastic layer of the villi, however, is swollen and misshapen. A macerated embryo of approximately 9 weeks gestation may be present, and fetal blood may be also present in the villi. A partial mole has 69 chromosomes, with 3 chromosomes instead of 2 in every pair. This could also occur if one of the 23 chromosomes was supplied by one sperm and one ovum that did not undergo reduction division, supplied by 46. Compared to complete moles, partial moles rarely lead to choriocarcinoma. Although still above average, human chorionic gonadotropin titers are lower in partial than in complete moles. Titers can also return to normal faster after mole evacuation.
These are the clinical manifestations of molar pregnancy. Molar pregnancies grow much faster than a fetus. The abdomen becomes larger much faster than it does in a normal pregnancy. Severe nausea and vomiting. Vaginal bleeding with spotting of brown blood to a profuse fresh flow at approximately week 16 of pregnancy. The bleeding progresses and will soon be accompanied by discharge of clear, fluid-filled vesicles. Symptoms similar to preeclampsia that occurs in the first trimester or early second trimester. This is almost always a sign of hydatidiform mole because preeclampsia is extremely rare this early in a normal pregnancy or 20 weeks of AOG. High blood pressure, swelling in feet, ankles, and legs, and then proteinuria.
Assessment and diagnostic findings. If the patient is showing signs of GTD, the doctor will talk to the patient about their health history, which may include questions about their reproductive history, and will also have a physical examination, including an internal pelvic examination. In pelvic examinations, the doctor will examine the uterus, vagina, ovaries, and cervix to check for lumps or any unusual changes. After that, additional diagnostic tests will be done, such as ultrasound imaging, or also called a sonogram. An ultrasound creates a picture of the internal organs using sound waves. In a transvaginal ultrasound, an ultrasound wand is inserted into the vagina and aimed at the uterus to take the pictures. A characteristic ultrasound appearance, often described as a snowstorm or clusters of grapes, is a key feature of molar pregnancies due to the presence of numerous cystic spaces. In complete mole, there is usually no identifiable fetal tissue or heartbeat. Next is human chorionic gonadotropin levels. Elevated levels of HCG are often observed in molar pregnancies. Extremely high or rapidly rising HCG levels can be indicative of a hydatidiform mole. Next is histopathological examination. After dilation and curettage or DNC procedure, the removed tissue examined under the microscope to confirm the presence of hydatidiform mole. Next is computed tomography or CT or CAT scan. A CT scan takes pictures of the inside of the body using X-rays taken from different angles. A computer combines these pictures into a detailed three-dimensional image that shows any abnormalities or tumors. A CT scan can be used to measure the tumor size and to check for metastasis. Lastly, follow-up monitoring. After a molar pregnancy is evacuated, regular monitoring of HCG levels is essential to ensure the return to normal. Persistent rising HCG levels may indicate the presence of gestational trophoblastic neoplasia.
So, these are the medical management for molar pregnancy. So, specific treatment methods for GTD includes first, surgery. Surgery to remove irregular tissues and cells from your uterus. The most common surgery used for GTD is a dilation and curettage or DNC. Dilation and curettage or DNC is a procedure to remove tissue from inside your uterus. In a dilation and curettage, small instruments or a medication is used to open or dilate the lower narrow part of your uterus or your cervix. Next, a surgical instrument called a curette, which can be a sharp instrument or suction device, is used to remove uterine tissue. Second is chemotherapy. So chemotherapy or chemo uses drugs to destroy cancer cells. Chemotherapy is the use of medication to kill cancer cells, usually by preventing the cancer cells from proliferating, developing, or dividing. Next is radiation. Radiation therapy uses strong energy beams to kill cancer cells and shrink tumors. Lastly, it is the hysterectomy. A hysterectomy is the surgical removal of the uterus. Other organs such as the fallopian tubes or ovaries may also be removed.
Typical medications used in gestational trophoblastic disease chemotherapy include methotrexate or Trexate or riomatrexate. It has recently been demonstrated to have comparable effects on intrauterine trophoblasts and is used to treat gestational trophoblastic neoplasia and ectopic pregnancy. According to a previous study, methotrexate can effectively induce an early pregnancy abortion in the absence of prostaglandin. Next, we have cosmogenic netromycin. It is also used to treat solid tumors that have come back or recurrent to the same site after a previous treatment. Actinomycin interferes with the growth of cancer cells, which are eventually destroyed. We also have etoposide, and we also have cyclophosphamide. Cyclophosphamide is a nitrogen mustard that exerts its anti-neoplastic effects through alkylation, a medication primarily used in the management and treatment of neoplasms, including multiple myeloma. And lastly, we have vinclozar or vincristine, a chemotherapy drug that belongs to a group of drugs called vinca alkaloids. Vincristine works by stopping the cancer cells from separating into two new cells, so it stops the growth of cancer efficiently.
So for nursing management, we should assess characteristics of pain, observe for nonverbal cues of pain, assess for bleeding, amount and characteristics, assess for emotional distress, assess for nausea and vomiting, also assess the ability to work of the patient. For therapeutic, assist in performing deep breathing exercises, assist the patient in diversional activities such as guided imagery, assist also the patient to a comfortable position, allow privacy to grieve, and provide physical care such as back rub or nourish as needed. Also, prepare patient for surgery as ordered, administer analgesics as ordered by the physician, and provide emotional support such as therapeutic communication. So for the health education, for the patient, instruct to do a relaxational activities such as deep breathing exercises when in pain. Also instruct to do a diversional activities such as watching TV and listening to music when in pain. Encourage also the patient question and verbalization of expression of feelings, as well as educate patient on how or why she should delay next pregnancy for another year. Instruct client to eat foods rich in protein, as well as educate about the importance of the follow-up assessments in order to detect early a gestational disease when it is almost 100% curable. Educate also patient or teach that any effective contraceptive methods may be used except an intrauterine device or IUD because of bleeding irregularities associated with the IUD. Oral contraceptives are the preferred method since they are highly effective. Lastly, explain the treatment program if a gestational trophoblastic disease develops. That's all. Thank you for listening.